Hi guys, welcome back. In this video we shall be continuing about the adult glaucoma. Now we already have discussed about the congenital glaucoma. In order to save some time, I have written some of the earlier points here, some of the important points I have written here so as to make the video short. So we're going to talk about the adult glaucoma. Now adult glaucoma is divided into two parts, open angle glaucoma and closed angle glaucoma. Now you need to remember the ratio of open angle glaucoma and closed angle glaucoma. This ratio is around 3:1 to 4:1. Okay, that means 3 times open angle glaucoma is more common as closed angle glaucoma, and the second upper range is open angle glaucoma is 4 times more common than closed angle glaucoma. Now we shall talk about the angle closure glaucoma. Angle closure glaucoma means in this you will be having iris and trabecular contact, and this contact, the angle will be more than 180 degrees. Along with this you will increase the intraocular pressure. Along with this there will be optic nerve damage. Now why intraocular pressure is increased? It is increased due to the trabecular meshwork is compromised, that it is blocked. The angle is blocked, that is the reason aqueous humor is not able to go out, that is the reason intraocular pressure is going up. Why this optic nerve damage? Due to intraocular pressure increase, it is compressing the optic nerve and slowly you are damaging optic nerve. Why there is iris and trabecular contact? It is due to anterior synechia. Now what is anterior synechia? The iris is going and attaching to the cornea, okay, the back part of the cornea. Why there is anterior synechia? Due to the accumulation of aqueous humor in the posterior segment. Okay, now let us try to understand why is this thing happening. I'll show you with a video photo. Alright guys, one second. Okay, so here we have the cross-sectional area of the eye. This is the lens. Okay, this is where your ciliary body, here is your aqueous humor being produced. Now it comes from the posterior segment, it comes out, and then comes out from the pupil, and then it slowly comes out to the anterior segment, and then it fills here, and then it goes out by this trabecular meshwork. Now what is anterior synechia? If this iris is pushed forward and touching to the cornea, that means if this iris is there, it goes and touches to the cornea, we will say this anterior synechia. Now why the anterior synechia will develop? If there is any aqueous humor being produced here, it will go and press this iris, and this iris will go forward and press the cornea. Now why there will be anterior synechia in the first place in this this phenomena? Why? Because whenever you are having mild dilatation, okay, remember this thing, this is very important guys. Here the mild dilated pupil, if the diameter is 5 to 6 mm, remember whenever the pupil has to dilate, right, whenever the pupil has to dilate, the iris has to relax. Okay, the iris has to relax. This is the iris. Okay, whenever the pupil is dilating, your iris has to relax. Whenever this iris relaxes, sometimes what happens, this iris falls down onto the lens. It falls down onto the lens, and there is no aqueous humor able to go out. So the aqueous humor is getting accumulated here. The iris has fallen down, that means it has blocked the pathway. The aqueous humor is slowly accumulating here. Once the aqueous humor is accumulating so much, it is going to push the iris forward. This iris will go and touch to the cornea, and it will block this angle. So this is what happening in angle closure glaucoma. Okay, so please remember the normal diameter of the pupil is around 3 to 4 mm diameter. Fully dilated pupil is around 9 to 10 mm diameter, and if you see for the mild dilated pupil, it will be around 5 to 6 mm. We see angle closure glaucoma more commonly in older age group, specifically in middle-aged women. Now why middle-aged women? Because the eyeball, the entire volume of the eyeball is a bit smaller as compared to males. Around 10% it is less as compared to males. That is the reason, even if there is a bit of a change in variation, women are going to be manifested more faster as compared to males. Along with this, if you are an Asian origin, your axial length is normal axial length is around 24. Normal axial length is 24, but in Asians this axial length is around 23.5 mm. Okay, along with this, if you're having hypermetropia, what is hypermetropia? This means your axial length of the eye has reduced. If the axial length of the eye has reduced, even if this little bit of aqueous humor production, it is going to hamper in a significant way as compared to a person who is not having hypermetropia. right? So this is about, so let us try to draw the diagram of the eye in a very simple manner. So you are having the eye somewhat like this, okay, and you're having the optic nerve here, okay. This is a very sketch diagram, guys. So you're having the cornea somewhat like this, okay, the cornea is somewhat like this. You are having the main eye here. From here you are having the ciliary body, okay, you're having the ciliary body. From the ciliary body we have another structure going like this, which is known as the choroid, okay. Here we will be having the optic disc and optic cup, is where when your nerves come in to enter the eye. We are having this is the choroid, this is the ciliary body. After this, if you see properly, you'll be having the zonual, you'll be having the iris here. You'll be having the iris somewhat like this. Along with this, if you see, here will be your lens. This is your convex lens, which will be suspended by zonules somewhat like this. Now this is the basic structure of the eye. Now again, if you want to make it more detail wise, then you can just make it. Now this is your vitreous cavity, this is your vitreous, this is your choroid, this is your entire the sclera, you can say. Sclera is the white part of the eye, and this is the cornea. You're having the optic disc and optic cup, is where the optic nerve enters to the eyeball. So this is about the basic structure of the eye. As I told you, let's say if I zoom in this part, if I say this is a cornea, this is your zonules, somewhat like this. Sorry, not zonules, this is your sclera. Again, you have your ciliary body somewhat like this. Along with this, you're having the zonules like this, which is giving attachment to your lens. Now, due to some reason, the iris has fallen back like this. The iris has fallen back. Why the iris has fallen back? In order to dilate the pupil. In order to dilate the pupil, the iris has to relax. Whenever the iris is relaxing, it is becoming flabby, it is becoming loose, the iris is fallen down. So whatever the aqueous humor being produced here, it is getting accumulated here, it is getting accumulated here in the posterior segment. Now this is going to push this iris in this manner, so as this angle is gone, okay, this angle will be closed. Here is your angle, this is the angle, this is where your trabecular meshwork is containing here, this is the angle we're talking about. Now as this aqueous humor is getting up, this is going to push your iris and going to close the angle. So that is what happening here. So that is the reason you will see closed angle glaucoma more in females, more at night, because at night your pupils are dilated. You will see in patients who are having hypermetropia, obviously the eyeball is shorter. Along with this Asian origin, even the size, and women around 10% the eyeball volume is small as compared to males. So that is the exact thing which is happening here. And whenever we are talking about glaucoma, we should be having a very clear understanding of the aqueous humor production and the drainage pathway, how it comes from, how it, again, just for a quick this thing, this is a ciliary body, here is your aqueous humor production taking place, posterior segment comes out, then you have the pupil here that comes to the anterior segment, goes out from this outflow. So here is the angle, okay, this is the angle here, we're talking about this angle here. So in case if you press the iris here, this angle is closed, that means the aqueous humor cannot go out and the intraocular pressure will go up. Right, so that was about this thing. So how do you know a person is having open angle glaucoma? Sorry, closed angle glaucoma. Why do I say open angle glaucoma? This is closed angle glaucoma, okay? We're talking about closed angle glaucoma. Whenever you're talking about closed angle glaucoma, you understand it will be emergency condition. It will be very painful because your intraocular pressure will go up, it will stretch the eyeball, and stretching the eyeball, it will cause the nerves to be stretched, and whenever the nerves are stretching, it will be excruciating pain. It will be extreme amount of pain, guys. So whenever there will be so much pain, the person will be crying, might be even vomiting. It is so painful, okay? They might say, just take out my eye, it's so painful, right? After that, due to so much pain, they will have colored halos. Now why there will be colored halos, you should understand. Whenever we're talking about the cornea, guys, whenever we're talking about the cornea, we are having 5 layers, but now recently we have 6 layers, okay? Now this, the most back part of the cornea is having a layer is known as endothelium. Now this endothelium is having one very special important function, is actually having aqueous pump. Now what is the function? Remember, always our aqueous humor wants to go and accumulate in the eye, okay? if the aqueous humor goes and accumulates in the cornea, your cornea will become hazy and you cannot see it clearly. So in order to compensate that, we are having aqueous pump here, which is pumping out the aqueous humor at the same time, right? But the pressure here is so much that this aqueous pump fails and slowly the aqueous humor comes and accumulates here. That is the reason you will see colored halos. Why you will see colored halos? Because of the aqueous humor, it is causing your light to split. That is the reason you are going to see colored halos. Along with this, why will you see sudden drop in vision? Because the cornea functioning is gone, because your cornea is not transparent anymore. To understand a basic understanding of how much important your cornea is, remember guys, whenever you go to your swimming pool, whenever you open your eyes underwater, you can see so blurry. In that condition, the cornea and the water surrounding your in your swimming pool is actually cancelling out each other's power. That means you're only having the power of the lens, not having the power of cornea. It's just an rough understanding, basic idea. So you can see if your cornea is not working, how much your eyes will be not functioning, right? Your vision will drop to so much extent. So water here will be blurry. Now again, the eye will be very red, obviously, because of the intraocular pressure is increased and iris is not seen clearly. Remember, the most transparent structure in your entire body is your cornea. And how we see the cornea? We cannot see the cornea in normal cases. In cornea, it can never be seen. We can only see the color of iris. Whenever you say, okay, I'm having blue color eyes, I'm having brown, you are not actually having the color of your cornea. You are having the color of your iris. Okay, so how do you see the transparency of the cornea? You see the detailed structure of the iris. If you're able to see the detailed structure of the iris, if you're able to see the detailed pattern of the iris, this means you are having a clear cornea. So if the iris is not clear, that means your cornea is not clear. That is the reason you're not able to see the iris, right? So you cannot see the iris clearly. Now how do you see the signs? Signs is what the physician does, symptom is what your patient will tell you, right? So as stony eye, that means the intraocular pressure will be so much that if you press the eye, will feel like that you're touching a stone. The normal intraocular pressure is around 10 to 21 mm of Ag. This is a normal intraocular pressure, but in angle closure glaucoma, in just half an hour, this pressure can reach up to 60 mm of Ag. Imagine the variation from 21 can go to 60. This eye will be very hard. It will be just like you're touching a stone. Along with this, we will see a steamy cornea. This simply means the cornea, it looks that there is steam. There's the water vapors there. That means the cornea is not clear due to aqueous humor entering the this thing. Along with this, even if you see the pupil, the normal shape of the pupil, if you see the eye, this is your eye, you are having the cornea, behind the cornea you're having the iris, and you're having the pupil. The normal shape of the pupil is round, okay, circular. Along with this, in this you are having closed angle glaucoma, your pupils will be oval. The shape will become oval. Kind of like this will become oval, will be mildly dilated, and will be non-reacting to light. Okay, that is what you can see. So closed angle glaucoma. So this is what you will see. Now there's another thing that whenever you, as I told you, there will be colored halos. Now remember, the colored halos is also seen in the cataract. Now this colored halos needs to be differentiated by a test known as Fincham test. Now this colored halo is seen in cataract and is also seen in angle closure glaucoma. How do you do it? You use by a test known as Fincham test, and here you use a stenopic slit. Now this is a stenopic slit. You can see there's a black circular disc and there's a small slit you can see through it. What you do is that you place it in front of the eyes and you tell the person that you're seeing the colored halos. Whenever there's a light, and you'll see somewhat like this, colored halos will be like this. You put it, and if the colored halos splits and unite, if it splits and unite, then this is a cataract. If it doesn't split and unite, that means there is no change. There is angle closure glaucoma. So that was about the angle closure glaucoma. We'll talk about the management later. And how do you know it? The females 50 years more, mostly seen at night, extreme pain, extreme pain. They might vomit. Their vision is dropped suddenly, huge colored halos, even vomiting. They'll say, just take out my eye. Iris is not seen clearly. Eye is very red. When you do the intraocular pressure, this can be very high, like 60. Normal is 10 to 20 mm of Ag. This can go up to so much. So that was about the angle closure glaucoma, and we'll talk about open angle glaucoma in the next video. Thank you for watching. Bye.